I knew I wanted to be in the medical field, but I didn't know what area I wanted to be in. I thought it would have been a good idea to observe doctors, nurses, aides, and see what it's like from each perspective.
High schoolers have the world ahead of them. Some may or may not have had good guidance in their life to help them see what they might be good at for their life path. Because we have this program, it's a good start for them to see what their options could be.
In my past, I had a friend who passed away from a genetic disease, and just watching him develop that was really hard for me, but at the same time I saw how his nurses impacted him and his family, and it meant a lot to me, and I figured that that is what I would want to do for other people.
2 years ago, my brother passed away, and it triggered something in me. I want to help people, and I was like, you know what, I feel like medical career is something that I want to do. Senior year started, and I figured out we had an internship program, so I talked to my teacher, and she hooked me up to Elkhart General.
It's not just nursing that they come and shadow. They've come into our laboratory department, they've come into the radiology department. There's many facets of healthcare that they can experience.
The staff is amazing. They're phenomenal. Everyone is so inclusive. They can answer anything that I ask them. It's just nice to be able to talk to people and get different people's perspective on maybe what they think that I should do in the future. It's nice to hear someone telling me, we think this is where you would fit in and where you would be able to grow.
What's interesting about watching them is you get to see their growth. On day one, when they come in, they approach the desk at the station. They're shy, they barely talk to tell you why they're there. They go from that to then just being comfortable to walk into the room and say hi to the patient, ask them what they can do for them.
I'm on a committee with the state that's been redefining our work-based learning. We are one of the only programs like this in the state. It sets us apart and makes our county unique.
I think it's great that we have schools in the community willing to bring their students.
I don't even think they're ready for what they're about to get when they start their internship. And it's really kind of cool to see the end result of it.
I think that this program as a whole is helping our community a lot because it gives students an opportunity just to experience something different. There are not very many people who can say that in high school they were able to work at a hospital and see the things that we see.
For them to come into a professional atmosphere where people have licenses and they're dealing with people's lives, that's a whole lot different than working at Subway, McDonald's, places like that. To see physicians, nurses, all of that variety of healthcare workers working as a team to save people's lives and improve the health in our community is amazing.
I think this is for me.
I'm kind of leaning towards a nurse, but I'm still observing the different fields.
Nursing is definitely something that I want to do. Now that I have this experience, it's something that's solidified in me.